Hi, many of you with a metal-on-metal hip implant may be watching this video for the first time, wondering what kind of damage is being done to your body from these metal-on-metal hips. We have created this video with the help of MediVisuals and their medical animations to show you the injuries that are occurring from cobalt and chromium ions being shed from your metal-on-metal hip device. At the end of this video, I'll discuss the diagnostic test that can be taken to diagnose whether any of the injuries are already occurring inside of you. First, this is an animation of a metal-on-metal hip implant inside the body. As we take a closer look, we can see that corrosion and wear at the location of the hip stem and ball causes debris to enter the blood and adjacent tissues. Cobalt and chromium ions are also being released between the cup and the ball. For patients with the recalled Stryker femoral stems, the cobalt and chromium ions are being released where the modular neck meets the femoral stem. These metal ions enter the bloodstream and travel throughout the body. Generally, the longer a metal-on-metal hip implant or a recalled Stryker hip implant is inside the body, the more cobalt and chromium will accumulate in the bloodstream. The systemic problems caused throughout the body due to cobalt and chromium in the blood are scientifically relatively unknown at this time. However, the injuries locally around the hip are very well documented. Let's talk about some of those. First, tissue destruction and pseudotumor formation. Cobalt and chromium ions attack tissues adjacent to hip prosthesis, and those tissues begin to deteriorate. Many patients with a metal-on-metal hip already have blackened, necrotic tissue. Over time, this tissue irritation and inflammation may cause advanced inflammation, weakening, and necrosis of tissues and form a pseudotumor. At first, this pseudotumor may be a soft pseudotumor and might not even be painful. However, it generally hardens and then sucks in more and more tissue and grows bigger and bigger until it becomes very painful, and the pseudotumor and the hip implant must be removed. Second, bone destruction. This is what the acetabulum and femur look like with a normal hip prosthesis. However, cobalt and chromium ions enter the surrounding bone, causing deterioration of the acetabulum and deterioration of the femur. Due to bone destruction, acetabular and femoral fractures may occur. Once these fractures have occurred, it may require a much more difficult revision. Third, joint fluid increase. This is what normal synovial fluid surrounding a hip implant would look like. However, the cobalt and chromium causes increased synovial fluid and pressure on the hip implant and surrounding tissues and nerves. Due to increase of joint fluid, dislocations may occur. Fourth, wearing away of muscles. These are the adductor muscles that cause the hip joint to function. Cobalt and chromium ions can cause adductor muscles to be worn away. Due to the wearing away of the adductor muscles, the hip joint may become non-functional. As we discussed, the cobalt and chromium ions from these defective metal-on-metal hips attack the surrounding tissue, bone, joint fluid, and muscles. Next, let's talk about the diagnostic test you should take to detect these injuries before any major complications occur. The first thing you need to do is to make sure you follow up with your orthopedic surgeon. He or she will likely recommend various diagnostic tests, including a cobalt and chromium blood test. Because the cobalt and chromium ions travel through the surrounding tissue, bone, and joint fluid first, a high level of cobalt and chromium inside your blood likely means you have quite a bit of cobalt and chromium in your tissue, bone, and joint fluid. If your cobalt and chromium blood levels are high, your surgeon may recommend for you to revise and replace your hip implant, even if you're not having any pain. In addition, your surgeon may also recommend an ultrasound or Mars MRI to detect excessive joint fluid buildup and/or tissue destruction. If you have taken a cobalt and chromium blood test, or if you have any questions about the harm to your body caused by these cobalt and chromium ions, please feel free to contact us. Ben Gordon and I at the law firm of Levin, Papantonio have been protecting the legal rights of numerous clients who have had a metal-on-metal hip implant or a recalled Stryker femoral stem. We would also like to speak with you.